Unfortunately, there's two parts of this. One of them is thyroid symptoms are so vague and also so common.
Yes.
And they can be misdiagnosed by something else. A lot of time people, they have sleep and they go to the sleep doctor. So the symptoms can be misleading doctors to another diagnosis.
Welcome back. You are watching the Dr. Nandi Show. Now, everyone has a thyroid, but not everyone understands how it really works or its importance to the human body. So I asked endocrinologist Dr. 𝗖𝗵𝗲𝗧 to come on the show to explain it. Welcome, Dr. 𝗖𝗵𝗲𝗧.
Thank you very much. Thank you for inviting me.
Of course.
Thank you for saying my name right.
that's a little challenge sometimes, isn't it? But the thyroid, what does it do and what's its function so that people who are watching can really know?
Thyroid is a small gland that we have here in the bottom of our neck here. It sits on top of our breathing tube, the trachea. And it's very important. We can't live without the thyroid. Everybody say have it. It is important for our metabolism. It's like the gas or the energy for the body. It controls your temperature, it controls your sleep, it controls your mood, controls your weight, controls your skin, affect your hair, affect almost every part of your body. And even every medicine, every food you eat and every medicine you take, it has to be metabolized by the thyroid. So it is very important part of our body.
It's kind of saying that, you know, if your engine is missing in your car and it's not going to work. You know, it's not going to work. So
Absolutely.
It's the engine of your car. And so why is it so many people misdiagnose, you know, thyroid disease or even think about it? Even many practitioners of medicine, you know, colleagues of ours.
Unfortunately, there's two parts of this. One of them is thyroid symptoms are so vague and also so common.
Yes.
And they can be misdiagnosed by something else. A lot of time people, they have sleep and they go to the sleep doctor. So the symptoms can be misleading doctors to another diagnosis. And unfortunately, the other part, we have a problem how we interpret what are the right tests to order, how we interpret these tests. Unfortunately, our medical training is more into this cookbook.
Yes.
You have this range, and sometimes I see a range, and you got, for example, B12 level coming from 200 to 1200. How's that normal range? How can be 200 just like 1200? Same thing for our thyroid function test. A lot of our doctors tell me, well, the patient should not have any problem because the thyroid tests are normal. It doesn't make any sense. There's a whole range of normal. Maybe my normal is on the bottom level and maybe somebody else normal in the highest normal. So when I change from here till here, I feel different. A lot of my patients, when we treat them and move them down, unfortunately, we don't know what's everybody's baseline, but when we move them around, we get them to the right place, they feel comfortable. We are missing something in our training also because we don't listen to our patients.
Yes.
We listen to numbers, we have cookbooks, we follow, and we actually blame patients when they don't conform with numbers. We believe the numbers more than we believe our patient. Unfortunately, that leads to so many of people who have thyroid problem, but it's undiagnosed and untreated because the doctor don't believe them.
And so, you know, the classic word is what? That the patient body doesn't read the textbook, and we think that it all is about the textbook. So maybe a little bit of information about the testing for people who don't know anything about thyroid testing. Could you tell us what are some of the tests we use in your practice to measure the thyroid?
We look at thyroid from different ways. One of them, exam.
Yes.
How does you look? Did anything on the physical exam suggest you may have thyroid disease? We actually feel your thyroid, and it's something a lot of people don't do anymore. And then we look at numbers, and then we also look at ultrasound. The ultrasound of the thyroid can tell me a lot of information. Sometimes the blood tests are normal, but the thyroid ultrasound tell me that this thyroid does not look normal. There's an autoimmune process, or there's a nodule, or something abnormal about it. Then we investigate further deep into the test. In terms of blood tests, a lot of people that order TSH. TSH can be also misleading you into a different diagnosis, and sometimes normal may not be normal for everybody. So we usually do TSH, we do free T4 and free T3. So if your doctor is not doing these tests for you, he may be either treating you wrong, adjusting your doses wrong, or not even diagnose you wrong. Yeah. So we combine all of them together. The blood test, the symptoms, the physical exam, and the ultrasound. Then I can make a judgment on the patients. So that's the perfect test to understand the patient. But if you're relying on one number, on one thing, you're always going to be wrong.
And so just so you follow what he said, TSH, the thyroid stimulating hormone, so with a signal that helps the thyroid make stuff. The T3 and the T4 are the actual hormones he's measuring. And so your doctor may or may not order all those tests. So sometimes you just order a TSH and that's it, and they make a judgment based on that. Now, what about thyroid cancer? You know, we had our last patient who had Hashimoto's thyroiditis, but thyroid cancer is still a concern, and you see it in your practice. Tell us about that.
So to start with, a lot of people now have the thyroid tumor called thyroid nodules. We see now a lot more thyroid nodules we ever seen in our life. So 95% of the thyroid nodules are benign. We monitor, we do biopsy, we check them out, and that's why I encourage people to do thyroid ultrasound.
Yes.
Especially if you have family history of thyroid nodule or thyroid cancer. But we're seeing now 1,000 times more thyroid cancer we ever seen in our life. There is a secret, like what is going on? Why are we seeing more thyroid cancer? Some people blame it because now we have ultrasounds everywhere and people are actually incidentally finding thyroid nodule. Then we're chasing the thyroid nodule. We thought it's showing cancer. But that's not the whole story. But why are we seeing so many more cancers that we didn't see before? I think there's exposure to chemical, to radiation, to food, to toxins, to inflammatory markers. There's so much connection with this. And not only thyroid cancer, we see other cancer coming because of this, but thyroid cancer connected also to radiation. We see certain geographic areas. If you're coming from a part of the world with wars, you see a lot more thyroid cancer than anybody else. Even some of the veterans who actually go to these areas, they get exposed to radiation. Sometimes they come back with thyroid cancer. So it's very complicated. It is a good prognosis cancer, but still, we don't take it lightly. We still follow it, we still chase it. If I diagnose one person in the family with thyroid cancer, I need to ultrasound everybody else in the family because you are at risk. And recently, I have a family of 4 who all have thyroid cancer, even the 15-year-old kid. So this is something we did not see before. And it's still, I think it's up to us, to all of the health system, to figure out why we're having more thyroid cancer we've ever seen before. We encourage our patient, please make sure your thyroid is being checked. Make sure your doctor, as we touching your thyroid and feeling it, see something abnormal, do an ultrasound. Just having a normal TSA does not mean you don't have thyroid cancer or thyroid nodule. And thyroid cancer does not give you any symptoms. If you wait for the symptoms, it's too late. You gotta know about it early, check it out, find out, prevent it, treat it before it is too late.
And the thing is that what's so important, what he's saying is that if you can find it early, you can cure these cancers. You can actually treat them. Some people tell me, I don't want to find out because I want to be dead anyway. And the answer is that with this cancer, definitely if you can get it early, we can get ahead of it. So thank you so much for your expertise and your passion about the thyroid cancer. Because we talk about thyroid disease, but people forget about thyroid cancer. Hi everyone, I'm Dr. Partha Nandi. And if you enjoyed that video, you're going to love the next one. It's full of incredible information to help you start your health hero journey.